gonorrhea and chlamydia. These are bacterial infections which spread quite easily through oral sex, often asymptomatic. And in fact, at shamelesscare.com, 80% of our positive gonorrhea cases are oral only. Your last STI test almost certainly didn't check you for these. The only way that you can be checked for gonorrhea and chlamydia is through a throat swab test. So if your last STI test was urine only or a genital swab and a blood test, then you have no idea if you have gonorrhea or chlamydia. So what's the best way that you can protect yourself? Again, it's doxypep. Doxypep is highly effective against gonorrhea, chlamydia, and syphilis. Less so against gonorrhea because there are some strains of gonorrhea that have been resistant to doxycycline, but that's been true for 40 years. There have been strains of gonorrhea that have been resistant to doxycycline for 40 years. Doxypep didn't cause that, but depending upon what strain of gonorrhea you may come in contact with is going to determine if doxypep can help you or not. Beats the alternative, which is possibly becoming infected, having to get treatment, having to disclose it to partners, being mandatorily reported to local county health departments as a gonorrhea case, as a chlamydia case, as a syphilis case, and not being able to have sex for a few weeks. All of those things are really inconvenient compared to doxypep, which is either free in your community or very low cost through shamelesscare.com.